So I think we all know each other. I'm Leslie Goldman, and I'm just calling us to order and going to pass it off to Dara.
Yes, thank you all for coming. I'm really delighted to have Amy Tomasso, who is a constituent. Yay. Lives in my town, actually, Moortown. And she was a local planner. We have a 3-town planning district in the Mad River Valley. We were a planner there for just a year, and then she got poached. And she is now a community planning and project manager with ACCD. And she has been really leading the charge with this exciting Homes for All Toolkit. And we're going to learn about that today. Welcome.
Oh, thanks, Sarah. Thank you, everyone, for having me. I know it's Friday and you've been really busy this week, so hopefully this will be not too boring or anything. But yeah, so I'm Amy Tomasso, Community Planning and Project Manager at the Department of Housing and Community Development, which is in ACCD. And so today I'll be talking about a few things. One, just kind of framing this conversation of public health and community planning, how they're really tie together so well, especially when it comes to the housing conversation. My focus is land use planning, but especially statewide housing. So that's obviously, what I'll be speaking to more, and then I'll go into the Homes for All Toolkit. So I work on the community planning and revitalization division, and I'll have my slides are up there. I know you're eating and look wherever is more comfortable to you. And don't worry about looking at me. It's lunch hour. So I have an amazing team of colleagues, and we focus kind of completely on village and downtown revitalization, health, livability, walkability. My focus is more on housing. And so we're the people and place team, I like to say. And I always want to frame the housing conversation, whether it's talking about housing affordability, accessibility, or housing and public health, in my why. And why I work on this is because it's about people and their homes. It's so abstract sometimes to talk about, the housing crisis and shortage and the data, and I'll get into just a couple data points, but ultimately it comes down to livelihoods and communities. And that's why I do this work, and always want to remind myself of that and frame my conversations in that, as well as the fact that it's a complicated housing ecosystem, and Missing Middle Housing Homes for All Toolkit is one part of that. There's so many other aspects, and we won't have time to get into them today. And your work probably touches that in many other ways as well. So just to kind of provide a little bit of more context of why the Homes for All work is so relevant and important. Well, we're facing a problem we can all agree on here in Vermont. And one way of looking at that is cost burden homes, which is when a household spends more than 30% of their income on rent and associated housing costs. And just some of the numbers in Vermont are fairly staggering. 31% of all households are cost burden, 51% of renters, 24, so almost a quarter of homeowners, and then 14% spend half of their total income on housing. That's really a staggering statistic. And I have pulled Washington County on the side just because I was actually using this for Waitsfield the other week, but it's, statewide still very staggering. And then we have this housing and demographic mismatch in Vermont. We have majority 67% single family homes, but then majority 1 to 2 person households in the state. So to put it kind of visually, we have these larger homes. This is a street in Barrie. And then Vermont household composition is changing. So that doesn't add up as one of the kind of drivers of the accessibility crisis of the housing stock. And then simultaneously, another mismatch is that our population is getting older. Seniors aged 65 to 74 are the fastest growing demographic group statewide, as you can see on the right. And yet a quarter of our homes were built before 1940. So again, to add a visual twist to that, we have what we're calling a real estate gridlock, where seniors can't necessarily downsize and then free up those homes for younger families and people who might want to come to Vermont and start a life here. So that coupled with the older housing stock, which can be really hard to care for. And then I love this infographic shows in a really cool way, but it's not a cool problem. Is that Vermont has the largest lot size in the country. Our average lot size is it's 1.8 acre is what approximately 78,000 square feet turns out to be. And lot size has economic, environmental, and also equity kind of implications for communities. And what it kind of boils down to mostly is you have to drive more between homes, they're less walkable communities, and also just more expensive lots and homes. Okay, that's it for some of the sadder statistics, because now we acknowledge, all right, this is a problem. But ultimately what this is about is creating healthy, vibrant places and communities. Obviously that touches on many things, not just housing, that touches on climate change and workforce and farm and forest viability. But let's kind of talk now about solutions and how we can support that and how this ties into some of the public health conversation, because it is very connected. So how do we make these vibrant places happen? And this photo is from a housing summit that happened in the Mad River Valley a couple of years ago. We were there. So, you know, there is a lot of energy and momentum behind making vibrant places happen. So this is a transect that I really like of kind of representing how we can plan for healthy communities and how community planning ties into so many aspects of what makes a community thrive, but also what makes it healthy ultimately. So when we talk about housing, transportation, you know, how bikeable, how walkable, can people get around? Are they car dependent, or can they be more independent in their transportation choices at different stages of life? Are there parks and open space and green space? But education and food access, like all of this ties into the community planning process and can shape how a community functions and who has access and opportunity there. So the real point here is that these outcomes can be deliberate. They can be planned for or not planned for, but hopefully in the inclusive outlook planned for. And so when it comes to Vermont, how can land use support public health? And I always look back to what's coded in the state statute of our land use goals, which is compact settlements separated by rural, countryside, farm, and forest land. And so here's another visual on the bottom there that shows on the left kind of more of this urban, less green setting, kind of more rare in Vermont, and then moving to the right, a much more green, undeveloped area. And our towns and downtowns probably lie somewhere in the middle. But really the goal is to create compact, walkable places which are lower in emissions. You know, they're more connected and can create these really vibrant communities while protecting the farm and forest land. And there's just so many dimensions of fiscal, environmental, and mental health outcomes that result when we plan our cities and villages even. And this is kind of the beauty of this transect again, that this can be at any scale, from the smallest village to Burlington and beyond. And so to kind of dial in then, like once we're in that compact center, the local code should really support diverse housing types. And you're going to hear me talk today a lot more about this concept of missing middle housing. I have a couple of visuals here that show what that is. So missing middle housing is a house type, it's a house scale. As you can see on the bottom left, it's that middle range that is not a single family detached home. And it's also not a large scale apartment building, you know, that like 40 unit or something you might see in a more urban area, but it's the duplex, the triplex, the cottage cluster, the backyard ADU, accessory dwelling unit, that range that fits, again, different lifestyles, different demographics, different incomes, different preferences. Not everyone wants to live out, you know, on the bigger home on a bigger lot and have to drive. And so it just creates much more diverse, welcoming communities. And so some questions that we ask when we're planning for housing, but for health equity, kind of around two sides of the housing. What types of new housing are allowed and can be built in a community? And then where can they be built? Can they be built near amenities, jobs, schools? Is that allowable in the zoning code? And that's a really important place to start the conversation. We're talking about neighborhood scale, and so to enable that scale of compact, walkable communities, density is really important, and increasing the density of what's allowed in zoning code, but in a gentle way. And so these are just some visualizations on the right. This is Swanton. That's what 5 dwelling units an acre looks like on the ground. It's pretty reasonable, I think. It looks pretty normal as far as community neighborhood scale. On the left, this graphic is from an organization we follow called Desegregate Connecticut, but that's 8 dwelling units an acre. It's a little faint to see, but it's 3 different ways of showing what that looks like. 4 duplexes or 8 single family homes or an 8 home apartment building, which still leaves room for a playground and trees and green space. So kind of approaching the density conversation from more of a visual and ground truthing aspect can help show what that actually looks like for communities and why it's probably a desirable thing, actually. And so to support that work, my department has given out now 63 bylaw modernization grants to update local code, things like reducing setbacks of lots, because that can really limit how much housing and how dense of the housing is built. Things like parking requirements, which again, some of these are fairly outdated. They're just not working with the modern present need across our state. And so we're working really hard with communities to rectify some of what's codified in the zoning bylaws, but then also create like much more of a welcoming zoning code. And that's really possible. So let's put this into practice and just show a little bit what this looks like in real Vermont communities. So first, this is Hyde Park, and just to kind of illustrate what I'm talking about. So here you can see in this aerial view, housing is close to daily needs and Main Street destinations and access to recreation. It's the Lomono Valley Rail Trail, and it creates this safe and walkable downtown. And this is pulled from the Vermont Health Equity Planning Toolkit. Kate worked on that. It's a really amazing tool that's linked here that I encourage you to check out. And it's all about not just housing, but all ways communities can plan for health equity. Here's another shot from Waitsfield in our backyard. And so, this just kind of shows that there are lots of steps that communities can take to become more development ready, such as bylaw modernization grant. Waitsfield's discussing a wastewater planning project. Obviously, infrastructure is huge to bringing more housing online. But here we see Irisville, which is kind of a sub-village of Waitsfield right now, a lot of roads, some kind of less dense shopping centers. And this visualization actually goes back to 2002, and just showing how some of this work is a long time in the making, but showing what a denser, greener kind of recreation corridors plus housing and then parking. There's still a lot of surface level parking in this visualization, I will admit, but what a different kind of master plan community can look like. And so these visualizations can be really helpful to get communities talking about their future and where they want to see growth and what it would mean. So that's kind of a part of this conversation, and totally again has this crossover with the public health conversation, because I would say that's probably a healthier, more vibrant place to live on the right than what's there now. So I'll kind of pause there. That's sort of my overview from the land use planning and how it intersects with the public health conversation. And now I'll move into this very specific solutions-oriented initiative that we've been leading at the department. And I have to say, I have been giving all my toolkits away. So it is a printed, beautiful document that I don't have any with me today because they've been flying off the shelf, but I can get you some if you're interested. But the Vermont Homes For All Toolkit is a design and do guide. So it's an interactive workbook for small scale developers, builders, investors, and community leaders. And so I'll talk for the rest of my time kind of briefly about what it is and how it can be applied to our communities across the state. So a little background, we're always trying to follow innovations around the country, especially when it comes to housing. And so this work was born out of a few years time following Maine and South Bend and Incremental Development Alliance. These are either groups or municipalities that have created, checklists for communities, how to become more development ready, or pre-approved house plans that we're seeing in South Bend that really streamlining the development process, or trainings for smaller scale developers. And we saw this need in Vermont of like, oh, we could step up and provide more resources actually for this sector of the development population of people who want to build that, duplex, triplex, quadplex, like innovate in their community without necessarily going and becoming this, multi-billion-dollar developer. Like that's not the developer we're trying to speak to here. So the toolkit is intended to reintroduce that missing middle house scale that I was talking about to Vermont by focusing our attention on small scale infill and incremental development. So that's infill is development within an existing walkable community, either on a side lot, a vacant parcel, or kind of on the edge of that town. And it's really intended to speak to small scale developers, emerging or aspiring, and local policymakers and also advocates who can then champion this work and create more momentum behind it. And I guess I sort of spoke to this before, but this type of housing you see up there, the cottage cluster in Bristol, or this traditional, what we call the big house, little house, back house barn, which is a very typical New England, but Vermont housing type, which I would say is like the original multifamily home here. And it was happened by accident, but it happened, and we see them all over. And this type of housing is very organic in Vermont, but there are a few reasons why it's been hard to build in the past, 50 years or so. Zoning is a big reason, separation of land use, decreasing densities in towns. And then, of course, this is a very pre-automobile development pattern because it's a lot denser. But we're hoping to change it and bring that back. So this is, again, a positive spin on why, yes, we're not seeing them built, but we're going to change that. So we kicked off Homes for All last May, but a lot of work had gone into it before then. We kicked it off in Barrie, but we visited many communities during that first visit. We visited Barrie, Montpelier, Randolph, White River Junction, Fairleigh, Bradford. We started to speak to the few existing small scale developers that are building the missing middle scale housing and do what we call precedent research of what's already on the ground in this kind of scale. So there's some pictures from last May. And then these are just a lot of examples of missing middle housing from around Vermont that are already there that we are observing. So you can see, the duplex in the bottom left corner, the village live work here. These are townhouses, cottage clusters, accessory dwelling unit. It's a variety of housing types that, again, caters to a lot of different needs and different lifestyle preferences, but also can create much more diverse communities because, the apartment versus the duplex, the triplex, like they all have a lot of appeal to where people are in their lives and how to bring more people ultimately into Vermont. So this is the cover of the toolkit. It is a 220-page product that, like I said, it exists now out in the world. And I'll just speak a little bit to the three components of the toolkit: the Builder's Workbook, the Missing Middle Homes Design Guide, and Vermont Community Infill Design Case Studies. So part one of the toolkit is kind of the major part, this Builder's Workbook, and it's a start to finish guide for those who want to start developing housing in Vermont. It could be renovations, new housing, it doesn't matter. The principles are often, start in the same place. And it's a very interactive book. You can see these are some pages of the toolkit with a lot of visuals and checklists and how-tos and diagrams. And we walk potential builders through everything from, building your team to design to permitting. And then once you have the home or the apartment or whatever it is built, how to manage it and how to abide by, fair housing practices and become a really good landlord too. The second part of the toolkit is a missing middle homes design guide. And so that's where we took a lot of our precedent research and we proposed then, as you can see in this upper right corner, 4+ housing types that could be replicated around the state. They fit really well in neighborhood contexts. They are attuned to the common lot sizes and vacant kind of lots we see around the state. And then each of them have flexible options. They could be expanded or have other unit configurations depending on the municipality that they would ultimately be in. And these are the 4, and I say 4+ because the telescoping house we have as an example, but we haven't actually kind of proposed that as the full typology. But these are, you might recognize some of these homes that we are modeling after, but we created, the aging in place 1 unit home. This is the narrow lot is a 4 unit. It's 4 1-bedrooms. That's a market need we see a lot. The village, I think, is a 3 unit, but there's a mix of 2 bedrooms and then a back 1 bedroom. It's a really good aging in place model. And then side by side is another, I think, 4 unit. And so some are narrow, some are wide, just depending on this common lot sizes we see. And then each in the toolkit, each home type we propose has a floor plan. So that's kind of as far as our designs go. And we are hoping to build this out into a set of 20 or so pre-approved plans that could work around the state. We'd be one of the first, probably the first state to do that. And then working with a few communities to maybe even take it a step further and say, could these be pre-permitted or really streamlined in these communities? So we'll have a call out, later this year. We're crafting that RFP, but I couldn't be more excited about that because that's how this goes from the conceptual, and even this is visual, yes, but how can this be translated into real homes on the ground? And I think it would just be so fantastic if, in Chester, if you wanted to build the narrow lot type, here are the 5 steps to make it happen. And there you go. And then each of these home types, has an accessible unit and an aging in place unit. So a ground floor unit with, larger doors and wheelchair turn radii and things of that nature. And then these are all 1 to 4 unit buildings and 1 to 2 bedrooms. And that's just a lot of the need we're seeing, but it's also a lower on-ramp for smaller scale developers. Code changes at 5 units and financing changes. So we're kind of proposing this, what we're called a sweet spot, to really help bring small developers into the fold and start on this project, and then they could grow from there. And then the last part of the toolkit is the neighborhood infill case studies. So we put out a call for applications back in June of last year. We received many wonderful, blew me away how many communities wanted to be part of this work. Ultimately, we selected Arlington, Bellows Falls, Middlesex, Rutland City, and Virgins. It was a mix of community sizes and demographics, and we're sort of progressive in the bylaws and also had local housing champions. And we went around to each of these communities. That's just obviously, where those are on the map. And we visited each one in last October, and it was incredible how many people came out. We spent half a day in each of these communities. We did a walking tour, a presentation and a conversation around growth and missing middle housing and what that could look like in each of these places. Rep Goldman was there with us in Bellows Falls, so thank you. And we did activities actually on these empty parcels that were potential infill sites. As you can see, there were cones out, measuring how much developable area there was on the site and discussing with the community, well, what would it be like if there was a home right here in your backyard? Very productive and encouraging. And then from there, that helped us refine the home types that I showed you on the slide. And then this is what it all looks like and how we kind of propose it in the toolkit. So this is an infill site that we worked with the property owner and the city of Rutland to propose one of the home types for. And, so the goals of this property owner were to provide rental housing and to really fit in with the neighborhood context. And so through those conversations, we came up with the side-by-side +1. Yes, we will probably have better names in the future iteration of this toolkit. But the dimensions fit the lot really well. The porch really fit in with the other homes in the neighborhood. And we were able then to cite the parking behind, because you really don't want parking or driveway to be the front-facing element that people are engaging with at the street level. And so this is what that visualization looks like in the end. So as you can see on the site plan in the upper right corner, the home is white, and then the driveway is kind of on the side and the back, parking in the back. And the home has some expandability options. There could be another porch on the second story, but as it is, it's a 3-unit building with one bedroom. Again, that's the aging in place unit in the back, and then 2 2-bedroom units. So that's a real market need in Rutland.
Yeah, are all these sort of the thought being that they'll all be on municipal septic and water?
So that's a great question. This one is, and it's much easier to do infill, admittedly, when there's municipal septic and water. Arlington was one of the communities we did a visualization on, and they are proposing an expansion of their wastewater, and this visualization tool is helping them in that conversation of, well, this is what would be possible if we had infrastructure. So it can be a teaching and a conversation tool as well to sort of show what's possible in a community. But certainly, infill is kind of meant to be where there's already infrastructure as well.
I'm curious if you have had any voice in some of the Act 250 discussions. Maybe you folks already know this, but yeah, I think that's really important.
Yeah, well, my team certainly has, and this works really well with those discussions too, of having like areas of the state that are kind of pre-checked of like, yep, this is a great place to develop. So let's streamline housing processes there, and like, nope, these are places we don't want more housing. And yeah, I hope so. Let's go through.
Good.
Yeah. I'm almost done, and then we can do some more questions, but all of this launched on March 14th at the Toolkit Trainer Summit in Barrie. We had over 200 people and a 50-person wait list. It was one of the most energizing events I've seen. We brought the toolkit to life with an interactive game of designing a site plan based on the typologies, and it was so cool. We kind of joked we've never seen that many people come out to talk about housing unless it was to shoot down a development. That was great. And then, as I mentioned, like, where is all this heading? Well, we're going to turn the toolkit into a live training cohort with workshops and modules and technical assistance for small developers who are actually working on a development proposal. So that's in the works right now, launch later this year. And then I also mentioned the pre-approved plan set. That's our other kind of next step. And then we're working on getting grants so that, or getting funding for grants that could go direct to developers so that they could have seed money and start these projects. Because obviously that's really important in this process, having missing middle funding. So kind of to wrap it all up, the toolkit's available online for free to download. You can just Google Vermont Homes for All, but I'll send these slides out, and it's also on our ACCD website. We have some pro formas that you can download. I mean, anyone can download and play around with. It's a really great tool to practice some financial feasibility. And then just please share this work with your communities, with others who maybe want to become a developer or have that side lot, some contracting experience, and just want to make the leap. And we're available, me or my team, to kind of share this around the state, to talk to anyone, or just to be a resource in this work. So thank you so much for your time, and also for all the work that you're doing at the State House and in your communities. And I'd love to take any questions you have.
Fellows Falls, right on the left.
Yep, yeah. That was our visit to Bellows Falls.
Mine's kind of more of a comment because this is tremendous and really wonderful. It's really fun to see this coming together. I think that, we sort of this year kind of set the framework with Act 250 about figuring really big picture where we want to develop and where we don't, and developing criteria that is, can be coordinated across tiers of government for that. And I think this sets us up to sort of start to color in what we mean by that. And, I work in a lot of rural communities where the wastewater challenge is profound. And it just seems like if we could understand, it might help us get a little clarity around the permitting of wastewater if we could wrap in housing goals and housing in the right places. And, that would add that sort of finer grain that is, I think, we have struggled to understand and apply until now.
Definitely, yeah. And the visualizing density is a really great tool and exercise for that, of really, sketching out what a town could look like with more housing units, and surveying the available space and lots, and then saying, okay, well, within these blocks or this kind of area, this is where more infrastructure could go and support X number of units. And that's all, doable with planning tools. Yeah, I couldn't agree more. The infrastructure conversation it's really a communications problem too, of showing, why it matters and why it's not so scary. I mean, and then of course there's the financing and funding part of that as well.
Yeah, this, I think, demystifies a lot of those things. It's incredibly helpful ways. Yeah.
Yeah.
So I have a couple of questions, and I think you do too. Yeah. Oh, great. So question, I'll be quick. I'm wondering so I was in the Bells Falls part, and the room was full.
Yeah.
And it was very cool, and there was great energy, and then people went out walking, and I went to the first walk, but I didn't keep it. So where did it land? Where are we now? I mean, because that's what I'm wondering about our community, just as an example. So you've come there, you've done your thing, then what happens?
Yeah, well, specifically to Bells Falls, I mean, each community is in a different place. The Dunbar brothers, who we surveyed their site in Bells Falls, they're ready to build this.
Oh, that's cool.
Yeah, and they're working with the town on just kind of finishing up the bylaw edits and things to make it possible. ARPA money has gone to some of the surveying, so like that's a really great case of how this will streamline their development process. Like I said, in Arlington, it's a teaching tool. They're just using the visualization to talk about wastewater. And each community, again, like it's in a different place. Where is the toolkit itself? Well, as you can see, yeah, that's the multi-year plan to bring this to life, and kind of create these grants. But this work is spreading around the state, and other communities are taking it. So Chester is doing this visualizing infill activity we developed from the toolkit, and the Regional Planning Commission, Mount Scottney, is working with Chester to visualize different sites. Rutland City and Rutland Regional Planning Commission and Bennington Regional Planning Commission are doing a summit in June with pitch sessions of small scale developers there and funders and regulators to give real-time feedback.
Wow.
These are just a few examples of how it's an idea that's now spreading around the state, and there's going to be other uses that I haven't even thought of yet,
Right.
Yeah.
So we obviously care about public health and,
Yeah.
the intersection, and you mentioned that, of course.
Mhm.
Do you work with the health department in any way? Is there any kind of
Mhm.
stuff going on in that world?
Yeah, so my colleague Richard Amore has just finished an amazing series of projects with the health department, and that's where the Health Equity Toolkit came out of. They have a podcast called Vermont Healthy Places, I think. I'll send all of this around.
That's great.
And so they've been doing a lot of overlap. They've had technical assistance in specific Vermont communities that have applied in to work on like a park project or a placemaking project. So I haven't led that work at all, but Richard is
Yeah, so it's happening.
champion.
Yeah, that's pretty cool. Thank you.
Yeah. And he said, by the way, he knew I was coming. He said he'd be happy to talk to anyone about that
Oh.
work. So
we'll end, yeah, go ahead.
I'm on a Colchester Planning Commission, and there's a lot of development at Severance Corners that we're talking about. Would you, like, how would I get you to come and talk to the planning commission?
Done. Yeah,
Great.
I would love to. We can follow up after.
Okay, that'd
Yeah.
be great. Thank you.
Yeah.
Can I mention funding session?
Yeah, maybe. Yeah, I'm happy to speak to housing committees, planning commissions.
Awesome.
And I really like doing that. We have this board game now activity that I've been bringing around. So if that's helpful to visualize, density and a site plan, really the sky is the limit. It's a cool project, but it's really then like how we all chew on it and make it relevant to each community. So
Yeah, the pre-approved is great. Yeah.
yeah, it's a cool idea. So we'll have a call for communities. I don't know exactly when. It could be, early next year. These things do take a little while to bring to fruition, but we'll have again a call for communities to be part of the pre-approved plan process. So stay tuned for that.
One question I have is we all are aware of the environment we live in, which is it's a kind of a twisted incentive system in the market economy that the most expensive houses are the ones that are being built right now. And that's because there's financial incentive to do so. And so I'm curious of the builders, of the developers that are interested in your plans, like, are they quasi-government funded agencies, or are there any actually for-profit developers who are really interested in developing this tier of
Yeah, that's a
housing?
great. I wish I had the picture. So, no, there is a huge number of these smaller scale developers who want to be, successful, financially viable, smaller scale, like maybe 16 or fewer units. Jonah Richard, you may be familiar with, he's in Fairleigh, and he's developed now a number of buildings, both new and renovation. And we kind of joke in the department, like our goal is to have a Jonah Richard in every community and have that be possible. Admittedly, probably the first couple waves of these small scale developers will be subsidized with, our grants, or VHFA has a lot of missing middle housing funding they're working on, just because we're priming the market, but it's not like it's a robust. It's been really hard to build these for a long time, so we have to do a little of that legwork. But yeah, that's our goal.
Just follow up on that, because I don't think everybody knows who Jonah Richard is, but I think one of the things that makes him unique as a small scale developer is the vertical integration. He has every part of the process is under one roof, so to speak. So like engineering, construction, design, et cetera, all. Yeah, so it isn't, a general contractor who's bidding out to a number of different folks, so it keeps the per unit cost down. I think I saw a project that he originally talked about recently, that he just completed 4 units at 250,000 per unit.
Yeah.
Which is.
So if you see on the screen, the bottom left corner, this is Jonah's new build in Fairleigh. I think it's it's either 7 or 9 units, but it's a amazing asset. There's a coffee shop in the front. Wow. And then on the upper right is one of his renovation projects in Bradford. And this was last May, but I saw it recently. You would not believe that. I mean, it's gorgeous, and he's starting to rent it out, and he now has his own GC. He employs 10 people, so it's like it takes a lot of grit and innovation, but it's people like that are making it happen, and can be a role model. And it's really beautiful in Vermont, as we know. Like it's such a place of sharing and helping, and like Jonah's ready to teach new developers. Zach Hale in Bennington, he's like, how can I teach? How can I help? So. Those are kind of our partners we point to, but we need a lot more than those.
Yeah, maybe 2 more questions. It's almost 1 o'clock.
Oh my gosh.
Yeah, I'm sorry to say.
Sorry, I'm just a quick question about like considerations for like the workforce needed behind all of this, and kind of like as we embark on all of this development to sort of keep in mind like what we do to set up like smart guardrails, incentives for like fair employment practices and a lot of employer provided housing to people without documentation or people who are like on the path towards getting documentation. Do you have any kind of like discussions around those issues and awareness? Do you hear about that?
Yes.
Like I know like the contractors are like, we really, really want these folks to be able to work. And like, we're seeing more and more crews, like the women are holding the ladders or like, you know, there's just a change in the demographic of who's building in Vermont.
It's true. This is where the ecosystem kind of framing fits in of like, that's such an important part of it. I was speaking with the Central Vermont Economic Development Corporation a few weeks ago, and this came up with them, you know, and that's the perfect place to be having that conversation because there are employers talking about workforce housing. And we generally say, like, we don't advocate for tying employment to housing because if you lose your employment, you could then lose your housing. And so I don't have a great answer to that, like just, you know, sitting here today, but I do know that that conversation is happening. And then actually, yeah, the other side of that we are thinking about is we need the workforce to build the missing middle scale. And so talking with the technical education centers and Yestermorrow actually is in the Mad River Valley, like there's different groups and it's going to take so many to start training, incentivizing and creating that scale of people who can build this too. Modularization is part of the answer because then you can build these at scale, this missing middle type. So many parts of it. I think for that piece, the regional economic development corporations are a really good place to have that workforce conversation too. Yeah, wish I had more of an answer. Yes.
I just wondered if there's been a conversation about, I mean, it's interesting looking at this, how that missing middle seems to fit really well with sort of mid-sized Vermont communities. Whereas say I'm from Tunbridge and all these little towns that are, it doesn't fit so well. Like we don't have municipal septic and water. We don't have zoning, all these things. Is there a different conversation about what, you know, it's probably half of Vermont's towns, what those towns would look like?
Yes. Well, yeah, it's interesting because the scale of the missing middle would fit well. The infrastructure isn't necessarily there. So it's more around how to get the capacity and the infrastructure there. But even in the smallest of bites, like the accessory dwelling units might be a good place to start, just and then there. Because one of our case studies was in Middlesex and we just focused on rural accessory dwelling units and what that could look like. And yes, it will be much more of existing septic capacity on one site and working more on a site-by-site basis, but there's a few resources for that. So Addison County, Washington County, and I think, well, those are the two that right now have accessory dwelling unit guides out, and they can be applicable to other places. And I think kind of starting at what's the smallest possible feasible house type that can happen. Yeah. And then conversations probably happening more in the state house around funding of the infrastructure needs to happen too, but. Well, thank you all so much. I'll send the slides with a PDF.
Sorry, we're all drifting away, but thank you so much.
Oh, that's okay, I know.
Incredibly.
I get that.
Wonderful. I
Thank you
think
for
we're at
having me.
1:15.
At 1:15. I just wanted to summarize for those of us that are left, where we've come this year, which is actually pretty amazing. It's our first year of the Public Health Caucus. We started with a conversation about the political determinants of health and how much policy really is at the top of the stream as all our policy affects things happening downstream. So really important to think about how I meant to bring through the lens of public health. I totally forgot. Okay, but that's where we started, through the lens of public health. That all our work, all our bills, we think about through the lens of public health. So that was our first, and then we had Wilmer Chavaria. Is that how Chavaria? Yeah, he was from the Winooski, superintendent of Winooski schools, and he gave an amazing presentation of the role of that the education role of school is very narrow compared to the social role of schools. And Winooski's a really good example of that, of how to support communities and children and to go way beyond our narrow view of what school should be. I thought that was profound. And we have that also on, thank you, Dan, for, he's been recording everything, so we have everything. And then we had a meeting with the Climate Caucus. They invited us, Dan gave a presentation and really introduced the idea of adaptation versus mitigation. Really important because we always think about mitigation, but not enough about adaptation. So that was an important start. And then today we end with you, Amy, and really appreciate that intersection of our built environment and our health. So what's next? Let's see, we have the summer. If anyone wants to participate, get in touch with any of us, and then we'll see where it lands next year. Just all beginning.
Thank you.
Thank you, guys. Great caucus.
Yeah.
Great presentation.
Thank you.
Thank you so much. Thank you so much. This is amazing.
Oh, I should add, I'm sorry. Thank you to the Vermont Public Health Association. Theo Kennedy is the president, Dan is the ED, who has totally been supporting us. We couldn't do this without Dan. Because like those of us on the steering committee are always like wandering around, like not knowing where we are. And he like sends a text, should you? Yes, we should. So that's really, we couldn't do this. And we thank the support for the meals that we've had.
Yes.
So thank you for that.
It's our pleasure. Well, let me just say, I'm so happy you had today's meeting because I missed the first two and thought it was, I was remiss as the healthcare advocate. We know, like Healthcare 101, that the real dynamics of what lead to health doesn't happen in the clinical setting. And yet we spend all of our energy focusing on the clinical setting.
Right.
And I am sucked into that on a daily basis. So it's good to be here and good to, I think, push for a really different lens about how we approach health.
Yeah, so be in touch. Oh, I'm sorry.
I'll just say I'm glad Mike's here.
Yeah, me too. Yeah, it's great. Because we want to try and refocus the conversation. I mean, lens, so how do we do that? And we're just beginning, and all beginnings are hard and interesting, and we'll see where we land.
Thank you, Leslie.
Yeah, it's been quite
Inspiring.
great. Yeah.